Amen.
Go.
So, a pleasant morning to each and everyone. So, we are the assigned reporters of the Module 6 entitled Developing and Implementing a Plan for Mental Health Integration into General Healthcare and Humanitarian Settings. So, allow us to introduce our name. So, I am John Kim Arlas Cudina.
I am Aljane Calderon Modernina. I am Reina Angelique Baltahara.
And I am Eugene Carasales.
We are reporters of the Module 6.
So, first to report is Miss Waldahara.
This module, Module 6, is developing and implementing a plan for mental health integration into general health care in humanitarian settings. So in this module, 9 mga learning objectives, which is they identify the need of integrating mental health into general health care in humanitarian settings. The second one is explain the priority mental, neurological, and substance use condition covered in MHGAP, HIG, or the Mental Health GAP Action Program, or the MHGAP. Mo ni siya ang training tool as in the clinical practice to help personnel detect, treat, and manage mental, neurological, and substance use disorder, as well as refer people presenting with this condition to the specialist. So mo ni siya gamiton na training tool para ma-assess to ang atong gakuan sa mental health. And then, why do we need MNS care during and after emergency? So first one, people are exposed to more stressors and the prevalence of most mental, neurological, and substance use condition increases. So, kanimong mga tao kay daghan man jud kay ay kitang tanan kay ma-expose man dito sa mga stressors no kay even atong friends, family kay muna mga stressors na to. And then people with severe pre-existing mental health problems are extremely vulnerable. So katong mga people nga nagsuffer sa mental health problems, katong mga na-abandon, na-abuse, and na-neglect. And then the need for services overruns capacity. Pre-existing services we have collapsed. People with a range of MNS condition need care, and crisis pose opportunities for strengthening mental health care systems. And the MNS care can restore functioning and assist crisis-affected people to cope better in their stressful situation. Kay para sa atong last nga report, atong ilang category, di ba, nag sila sa about also sa atong role play, kaya atong mga nakuan sa sunog, das dili lang na pwede mo hatag ka ng mga need nila, atong mga basic need na mga delata, mga foods, mga kuan, mga shelter. Pero kailangan ko na to i-assess ang ilang mental health kay maka-cause man to sila ng trauma. And then, challenges implementing MNS care and humanitarian settings. So, challenges include limited time to train healthcare providers, limited access to specialists for training, supervision, support, mentoring, referrals, or consultation, and so limited access to medicines due to disruption of usual supply chains. And then, ang kaning MHGAP, Humanitarian Intervention Guide, mo siya ang kanang, di ba mo siya ang assess sa, ay mo siya ang training tool. So, ang akong mga ka-groups kay sila rin mo, sila rin mo explain and mo discuss ato. So, ang content ani sa MHGAP, mo siya mga advice for clinic managers, general principles of care, significant symptoms of acute stress, significant symptoms of grief, moderate severe depressive disorder, post-traumatic stress disorder, psychosis, epilepsy, intellectual disability, harmful use of alcohol and drugs, and suicide, and other significant mental health things.
Ako ang module at MHGAP, HIG. So, ang kaning mga modules diri kay mo siya ang specific na guide nito or dili na to mahigaw man kanang mga lessons ba like atong sa explain kanina na kanang mga content atong unsang content ani nga module. So the first module is moderate severe severe depressive disorder. So, di ba, sa atong person pa lang na kabalo na ta, unsa ang depressive disorder? So, mo ni siya, napulit siya yung module din. Inhumanitarian activity significant losses and stress may result in grief, fear, guilt, shame, hopelessness, and depression. So, naday diri na to mabawan tanan ang unsa ang kuan kanang mga stress result kay kanang unsa ang kanang broad nga explanation ba like sa unsa ang mga cause sa kuan kanang severe depressive disorder. Next is ang content aning nga module is the guide covers or advice for clinic manager. General principles of care, then brief modules of assessment and management of or the significant symptoms of acute stress, significant symptoms of grief, moderate severe depressive disorder, post-traumatic stress disorder, psychosis, epilepsy, seizures, intellectual disability, harmful use of alcohol and drugs, suicide, and other significant mental health complaints. So, muna ang sulod atong book sa moderate severe depressive disorder. So, wala naman ka ng sabotable or understandable na sa ito ang kuan kining ang uban ani nga content kay sa first term pa lang ta kabalo naman ta like atong ang kuan sa una atong subject sa una. Next is the example of a module in example hapon ni siya. The epilepsy or seizures. So epilepsy is chronic condition affecting all age groups. Then supply of anti-epileptic medicines might be disrupted without these medications. Then people may have life-threatening seizures again. So mo ni siya ang assessment dayon basic mo na siya o makita niyo sa pictures like na siya assessment then basic management plan. So kani nga module is nag-provide siya sa assessment and management plan. Then next, mo ni siya ang content sa module nga epilepsy and seizures. Same ra gyapon sila no, same ra sila tanan pero dahil lahi siya og kanang title bitaw sa module. Now balik naman ni at nadi siya na nadungag. Pero kasagara balik-balik ra jud siya kay kon naman ang isa man sa ang tumong raman jud kabalo naman jud tama ang tumong aning sa kanina tanan nga module is about naman sa psychosocial support. The next is the advice for clinic managers. So number 1 is creating environment for service like having private space, then creating service model or having at least one staff member have an MNS duty. So, ganun creating environmental for service or having a private space is mo ni katong same atong role play bitaw nga dapat di ay kanang di ba kanang makikita ka o kanang client ka na siya private space like pareha tong counseling ta di ba like private space dito siya kay one man kanang close area then kita ra po so dapat ato din siya. The next is creating service model and having at least one staff member to have an SPT. So, ang example ani is kuan kanang sa isa ka municipality, di ba nadto na kuan kanang nadto na like punitan social worker nadto na dira na assign kay kuan kanang dapat man nadto siya or nabito naka-assign jud siya nga duty kay at least one lang daw. The next is staffing and training or staffing training needs and staff orientation. Dayon. Next is referral. Having a list of referral agencies like pariha atong gikuan nga kailangan ka nang muling juta sa kanang mga uban nga agencies para kuan kanang murag daghan bitaw og maka-help bitaw sa uban pang kanang mga nag-need. The next is need for raising awareness of available services. So kung ano kanang pareha na karon kay murag na broad na pud siya it is because kanang sa social media di ba daghan na kayo kanang mga awareness ay hinuon daghan pud siya og kanang disadvantage ang social media kay daghan pud siya mga fake news pero ang awareness pud ato is kuan kanang di ba kanang naay mga balita kay kanang naay mga patay dili sa kuan patay dili sa di ba aware ka ba nga imbis mula ako sa kadira nga area pero naay kuan di ba aware ka murag mawala imong interest kay syempre ang safety dun sa tao ang atong hanaon. Next is ensure constant supply of essential medicines. Makuha na to ni kanang mga medicines kay kanang sa mga health center di ba na may mga gipang-give dira pero kanang mga supply sa mga health center nagikan po na sa atong government. The next is information management or data collection of confidentiality. So mo din siya ang katong mga information bitaw like di ba kanang magpa-check up or kung saan inyong ba di ba mo tanang pila imong edad asa man kagabuyo na. So ikamura jud duha ang makabaluan na dayon confidential yan na siyang information. Next ano tani din naka sa structure.
Harapit ka?
Structure.
Diri ko kasugod sa kwan o. Diri ko.
Sige. Alam ako pa diyan siya. Muna, katuning module nga moderate severe depressive disorder. So, part 1 is an introduction to the condition with key information including commonly reported complaints of symptoms. Then, ang part 2 kay key assessment questions. And part 3 kay basic management plan with psychosocial with pharmaceutical intervention. So, kini kasabot na dibanis. Then next is MHGAP has been an integral component of response to major emergencies. So, sa bubuan, sa Guinea, ang Guinea is nagyapon ni siya ng country. Trained mental health care workers at PHC level were trained to provide mental health care services to the community, including Ebola survivors and their families in the district most affected by Ebola. So, ang Philippines is as part of an emergency response to Typhoon Haiyan in all health facilities in affected regions. At least one staff member was trained in 155 of the region's 159 rural health units, 98%, and in 29 of the region's 32 district and provincial hospital, 91%. So, to be continued by
So, my topic is all about Japon sa MHGAP or Mental Health Gap Action Program. So, MHGAP to guide facilitator and training ng specialist healthcare. Kato na silang murang pag-assess bitaw sa mga tao nga naisakit sa mental health, neurological, o substance use. So, nasa ka ng training package. First is suggested training schedules. So, di ba, maghimo mo schedule sa kung saan nyo pag-conduct sa inyo ang buhaton nga mga facility. Learning objectives, kay katulang i-sgot kanina ni Guadalajara. Tips for planning, facilitating in the training. O kung sa inyong mga buhaton nga So next, kay na siya MHGAP, HIG, training of healthcare providers. Sa training 1, initial training of 3 days, introduction to MHGAP, kay na siya mga general principles of care. First is communication, second, protection of human rights, then next, attention to well-being, assessment, management, or strengthening social support. Mga condition nga na diri sa training 1 kay na acute stress, grief, moderate severe depression, suicide o psychosis o epilepsy. So di ba gisgot naman si Laportina gisgot ni mo ang sa mga meaning sa condition lagi. Dayon ang training to kay follow up lang siya sa training 1 nga sa sa about sa MHGAP, HIG. So the operation manual, the MHGAP operation manual is designed to provide practical step-by-step for implementation of the Mental Health Gap Action Program. It includes the tools necessary for preparing, implementing, monitoring, and evaluating the MHGAP. So na siya target audience. First is district health managers in administrative units who are responsible for managing public health and mental services. So na siya mga link nga gusto ko idagnamoy mga some problems nga pwede ninyo ma-link dito sa DOH, means district health officers or district health administrators. Dayon the second kay other stakeholders, potential members of MHGAP training. Kaya mga examples ko dito mga government agencies, na governmental organization and community-based organization. So, ang MHGAP na siya different phases of implementation. The first is planning. Implementation in an iterative process involving formative planning and modification. First, assemble an MHGAP operation team. So, mag-assemble sa healthcare operation team kaya di ba, dili mapuka mo lang kung siguro isa ka situation nga mo sulod nun. So, nakaplano kayo mo kung sa inyong like buhaton pa na. Then next, kay mag-conduct kag isa ka situational analysis. For example, service delivery gap analysis, identifying gap in mental health services. Katong Dayon next, kay develop an MHGAP operation plan and budget. So dapat naka-budget na ang imong funds kayo. Dili mo ka pwede na mabuha sa imong own nga kwarta. Dapat nakahanay na dito kung saan imong plano nga makuha nimo dili magamit ang imong kwarta. Dayon preparation. Preparation of the health system and building capacity of the workforce to deliver services. Adapt components of the MHGAP package. The preparation of the mental health system is to build the capacity of its workforce. Mga is essential for ensuring the individuals with mental health needs, and promotes recovery and well-being. The main goal of adapting components of the mental MHGAP package is to improve access to evidence-based mental health care in diverse settings worldwide. Then the next one is provide education in the different levels of service provision, including facilities and community care. The goal is to improve mental health outcomes and reduce the burden of mental health illness. Provide services at facility level, provide treatment care in the community. So dapat tayo pagtagad sa atong community, dili kay pasagdaan lang nako makabalo lang tayo kung sa mga problema dili, pero kung ibagal wala na bitaw na to. Dayon mag-raise awareness to those people nga naay mga sakit sa mental o katong neurological condition. Kay as a social work student dili man kay ikaw nga student pa ta, dili na ta kabalo mo advice sa mga tao nga naay mga sakit, may mga mental disorder. Dapat, di ba na may friends na to? Di ba naman dito yung friends nga may mga problema. So, dapat kita dyan maminaw ka or maghatag tag advice. Kaya kabalo man dyan punta ka kung sa dyan ang so, next.
So this is the continuation of the report of Miss Cadosales. So my topic is about the procurement of psychotropic medications and emergencies. So in some way, anybody of the class na kanang kabalo sa meaning sa procurement kasi sa knowledge. Sige, when we say procurement, it is the process or the procuring of psychotropic medications in emergencies like sa kanabitong ay mga natural disasters sa ating mga community. So when we say po sa kanang psychotropic medication, it is refers to the group of drugs or medicines that the doctors may prescribe to treat a variety of conditions or variety of kanang mga sakit. So these medications or these psychotropic medications includes antidepressants, anti-anxiety, antipsychotics, and stimulants. So makita na to sa slides na nakapitaw sila yung example na Interagency Emergency Health Kit in 2017. So makita na to sa slide na nag-serve sila of 10,000 people for 3 months supplementary module for 10,000 people for 3 months includes the mental health medications and anti-epileptics or katong sa epilepsy na sakit. The next slide na siya practical tips. The first practical tips is the supply of psychotropic medicines may be interrupted during humanitarian emergencies or humanitarian settings. So, when procuring a medicine, take account of the continued needs of individuals who were receiving the MNS care before the crisis. So, nag-stage siya during supply daw sa psychotropic medicines kaya ma-interrupt during the humanitarian emergencies. Like, alam ito, ma-interrupt siya due to the various factors like the infrastructure damage, road damages, disrupted transportation networks, and restricted access to affected areas. So, for example, guys, naabot ang mahitabo ng natural disasters sa isang community. So, like an earthquake, so nadyan siya yung mga possible problems na mahitabo after the earthquake, like tayo mga roads, mga guba, mga bridge, mga guba, na siya yung kanang kahoy ng mga tumba. So, in that case, kanang ang individuals, kay mag-isod sila o kanabitang assess sa ilang mental conditions, kaya ang delivery sa psychotropic medications kay ma-interact. So next, second tip, kay damage gap operation team should also take account of safety, basic physical needs, and human rights. So basic mental health and psychosocial care should be available throughout the crisis for people with severe illness conditions living in hospitals and residential homes. Especially early in the crisis, as the risk of severe neglect of abuse of people in institutions is extremely high. So, nag-stage siya nga, MH Gap Operation Team daw kay take account sa safety sa mga affected nga individuals during the emergencies or during the crisis. Then, the next kaya ilahang basic physical needs such as katong ilahang mainom nga tubig, katong libro nga mainom nga tubig, ilahang pagkaon, ilahang shelter, ilahang sanitation and medical care, and most of all, ang ilahang human rights. So next slide na present po din nga kanang module sa mga tools for the Mental Health Gap Action Program operations. So na siya yung present nga 6 ka set of activities. First, kay katong identified facilities, communities, or geographical location for areas for MH Gap implementation. So first daw, ang kanang Mental Health Gap Action Programmer daw kay mag-identify sa siya sa kanang bitaw mga possible nga areas or location na naay mahitabo ang crisis. Next, mechanism to support fund facilities with the infrastructure, equipment, and support necessary to provide adequate services. Next, human resources from whom capacity building is required and clear descriptions of the rules and image gap implementation in the district. Example is orthopedic medicine supplies, pharmacies and healthcare providers trained in prescribing. Next, mechanism for collecting, analyzing, and disseminating information on the services provided. So, ang MHGAP operational team daw kay mag-collect of data sa mga affected nga individuals in that time of crisis. Next, activities to raise awareness of the services available in the community. So, ang MHGAP team sab daw kay mag-raise sila og kanang awareness or symposium about sa kanang natural disasters like earthquake and typhoon. Next, collaborative activities with all relevant stakeholders in planning, preparing, providing services with MHGAP. So, last na ilahang gibukang activities kay ang MHGAP operation team mo link siya sa kanang ilahang community services like sa tuwang munisipyo natay mga LDRRMO. So mo connect ang mental health gap action programmer para na ma-event. So next ana nga slide na present sab siya og kanang sample sa mental health gap action program operations plan. So makita dito ang activity, then unsa siya nga time, unsa siya nga bulan mo kuan nga kanang crisis, the next ang responsible officer or agency, and last ang resources required. So ang MHGAP package na sab siya upat ka components. So ang first na components mo ang MHGAP HIG or the Mental Health Gap Action Program Humanitarian Intervention Guide. So when we say Humanitarian Intervention Guide, it is a sample practical tool that aims to support general facilities and areas affected in humanitarian emergencies or crises in assessing and managing acute stress, grief, depression, or post-traumatic stress disorder or PTSD, psychosis, epilepsy, intellectual disability, harmful substance use, and suicide. So, kaning nga tool, kaning MHGAP HIG tool, kay widely used gid siya as evidence-based manual for the management of the medical conditions in non-specialized health settings. So, magamit jud siya in terms ng mga crisis. Kaning nga tool, magamit siya in terms ng mga crisis, managalisod ang mga tao na mga mental conditions about atong tabo. So ang objective sa kanila tool is to give treatment sa katong mga affected individuals. So second component ato is MHGAP training materials na gi-explain kanina ni Ms. Cadosales. So ang third is ang PM plus Thinking Healthy Group IPTSH plus or the manualized psychological interventions. So these interventions that are performed according to specific guidelines for administrations, maximizing the probability of therapy being conducted across settings, therapies, and clients. It is also called a manual-assisted therapy or manual-based therapy. So next components, ang last components niya kay mga MHGAP Operation Manual. So it is an integral component of the MHGAP package and supports district health managers and other responsible for integrating mental and physical health services. The manual offers practical guidance for necessary tools for planning, preparing, implementing, monitoring, and evaluating MHGAP. So kani siya nga tool, magamit siya sa mga MHGAP operations. So dako kay siya tatabang especially sa mga health managers sa kanang community kay makabalungan sila kung saan pag-prepare, kung saan pag-plan, kung saan pag-implement, monitor, kung evaluate sila sa katong nga event. So next slide kay nag-present sab siya og examples of monitoring indicator for mental health integration in general healthcare and emergencies. So ilang i-present diri nga objective kay people of all ages have access to health care that addresses mental health conditions. Ang ilang indicator kay percentage of primary and secondary health care services with trained and supervised staffs and system for managing mental health conditions. Ang ilang target percent is 100%. So ang ilang notes and definitions about this monitoring indicator kay to include a general healthcare facility, at least one staff should be trained during the last 24 months and supervised or on managing mental health conditions. So example ato is katong maggamit ta og tools nga katong MHGAP HIG or Humanitarian Intervention Guide. Kay para ma-facility kay mag-refer sila sa kanang system sa place kung unsa ang nahitabuan na niya nga place. So next slide, nag-present sa siya dili og mga additional resources. For more information about this topic, developing and implementing a plan for mental health integration into general health care humanitarian settings. So nasa ko isang galing sa inyo ha para sa inyo more information about the components of MHGAP package. So that's all I want.
Iposa.
Identifying suitable tools and integrating psychological intervention into health and social sector implementation plans and emergency. By the way, I am Angel Pimentesa.
I am Grace Marimar Tuhan.
So, ang among topic kay about siya unsaon pagpili sa mga effective approaches nga atong i-conduct during na emergency. So, na learning objectives. The first one is understand scalable psychological intervention and why they are important. The next, describe the key aspect of psychological intervention program design and implementation. Understand examples of open access psychological intervention and where they could fit within a sleep care model. Describe what you need to consider when adopting psychological intervention for different modes of delivery. Why psychological intervention? So, fast facts. Emergencies are a risk factor for prolonged suffering, emotional distress, and mental disorder. So, during emergencies, apektahan nila itong mental health, labi na if na makasaksi bitaw ta, like during calamities, during na nang ipatay-matay or what, na maapektahan dito kay murag maka-trauma bitaw sa atua. Next is psychological intervention can be effectively delivered by non-specialists. So, ang psychological intervention, dili lang to katubitaw yung naka-train jud bitaw ang mo deliver ato nila. Pwede gihapon siya basta katong mga tao lang bitaw nga na sila'y alam about kanang unsa ang psychological intervention, like for example kay mga non-specialist nga pwede maka-deliver sa aning psychological intervention kay ang lay counselor. So these are individuals who are receiving specific training to provide counseling services but do not have a formal mental health degree. So, even wala sila formal mental health degree, allowed gihapon sila na mo-conduct atong psychological intervention. The next is nurses. While their primary role is in general health care, nurses can be trained to deliver psychological intervention, especially in settings where mental health professionals are here. Next is midwives. In the context of perinatal mental health, midwives can play a significant role in identifying and managing mental health issues given their close contact with mothers during the pregnancy and postpartum period. So maunto siya ang example sa mga non-specialist nga pwede makadeliver sa psychological intervention. The next is, there is need for innovative low-cost solution to mental health burden in all countries. Psychological intervention or practices. So, even though na natin mga psychological intervention nga naadri nga atong mga naandan, but since daghan na kayo na types of mental health issues, mental health problems nga atong ma-experience nowadays, so kinahanglan bitaw siya kabaguhan, new, anong murag, kung sa balay pa, dapat siya i-renovate para mas effective pa bitaw kayo. Siyempre, ang problema ko kay mag-usap-usap na ay magpugang, na ay mga types nga of mga mental health problem nga atong ma-experience, sabi na karon nga, paano tayo. So, kinahanglan siya og improvement pod nga para mas effective pa jud ang atong pagkuan sa intervention. Psychological intervention are at least as effective as medicine, but inhibition is required to scale them up. Then, towards scalable psychological intervention, dili kay conventional psychological intervention. So, ang conventional psychological intervention, ano siya, ang evidence-based approaches that have been widely used and studied in the field of mental health. These interventions are typically delivered by trained mental health professionals. So, kung katong ganina nga, akong gingon nga, pwede siya ma-deliver bisag dili bitaw siya kanang murag na degree gid bitaw. So kani siya kanang murag intervention dapat ang mo-deliver gid ani katong naka-trained mental health professional bitaw jud like psychologist, psychiatrist o licensed therapist. So ang example sa conventional psychological intervention kay cognitive behavioral therapy or CBT is a widely used approach that focuses on identifying and changing negative thought patterns and behaviors that contribute to mental health issues. It aims to help individuals develop healthier coping strategies and improve their overall well-being. Next, interpersonal therapy or IPT. IPT focuses on improving interpersonal relationship and addressing specific interpersonal issues that may contribute to mental health problems. So it helps individuals develop healthier communication skills to resolve conflicts and enhance their social support networks. So, there na punta sa ang conventional psychological intervention auto by specialist gud ang mo-deliver sa ilaha. One treatment manual per problem, often mini session and required diagnostic assessment. The next is more scalable psychological intervention. So kana siya nga intervention are designed to be more easily disseminated and delivered to larger population. So balik ka lang sa mga dako siya nga area na kana siya nga intervention. So ang example niya kay ang guided self-help intervention. So guided self-help intervention involve providing individuals with structured self-help materials such as workbooks or online resources, along with guidance and support from a trained professional. This approach allows individuals to work through therapeutic materials at their own pace with periodic checks in from facilitator. Guided self-help intervention have shown to promise its scalability as they can deliver remotely and require fewer resources compared to traditional face-to-face therapy. So, next is technology-based intervention. With the advance of technology, digital mental health intervention have gained popularity and scalability. This intervention includes smartphone apps, online therapy platforms, and virtual reality. So technology-based intervention can reach a larger audience, provide flexibility in accessing support, and be easily scaled up to meeting their growing demand for mental health services. Who can deliver this and where? So, kinsa tong pwede mag-deliver sa psychological intervention o kinsa tong pwede mo basta deliver pa ito. Design for different implementing non-specialist and also specialist. So pwede po specialist, pwede po siya non-specialist, depende sa intervention may imong i-deliver. So, nadiri ang community workers, health workers, social workers, protection workers, then also specialists. So, design for multiple platforms. Mo ni siya ang pwede dito sa health system, protection system. Can be offered by NGOs or government, designed for multiple countries with adaptation. One part of the wider MHPSS response. So the next is an interagency standing committee, IASC MHPSS guidelines. Psychological intervention are level 3 within a system. So na-draw sa level 3. Focus target psychosocial support ang example kay intervention for subset of people with identified emotional problems.
So, scalable mental health, psychological support, intervention, delivery. So, makita nyo na there are different delivery models. So, from lower resource intensity to higher resource intensity. So, first is unguided self-help. So, mo sila live book or online. So, second is guided self-help. So, narin ko, wala sila. So, ang ikatulo is group and telephone delivered intervention ng specialist. So, na-mention na ni Manpisa kung saan na specialist. So, sa ikatulo na sila murag na connection or na sila something na connection kay through sa phone, telephone, AI. So, ang ikaupat is multi-session, individual, face-to-face delivered intervention ng specialist. So, diri, actual na sa home at tutungan sila para implement ang ilang intervention. So, ikalima is ang specialist na rin ang nag-deliver ng intervention. So, next is, are these intervention enough? So, no, use of step care. So, naay siya yung duha ka step. So, first step is first, offer most scalable intervention. So, parehas sa self-help book such as doing what matters in time. So, magkuhan daw pag mga kuhan, di ba ini ma-stress ka ng upseted, di ba ini mo basta sa mga motivational, di ba may kapatong kuhan ang ate. So mo nang step 1. So ini ang step 2 kaning step, ini ang step 2 kaning ang step 1 daw kung dili ni siya kuan mag-work. So mato ka sa more down intensive care, more resource intense intervention if available. So like multi-session, counseling, psychological treatment by non-specialist. So introducing scalable psychological intervention does not reduce needs for specialists. So first is produce more referrals to specialists. Second is better use of specialist resources like complex cases. So, specialists often provide implementation support, training, and supervision. So, implementation of psychological intervention. So, implementation of psychological intervention requires a number of key considerations. So, first is selecting an appropriate psychological intervention and developing an implementation strategy. So, ini mag-select daw kag mga intervention, dapat mo fit po siya para mo fit siya kung sa intervention gigamit nimo para maka-develop ka og mga strategy, implementation strategy. So, ang ikaduha is adapting a psychological intervention to fit a specific context and culture. So, para sa giingon sa last reporter about dapat mo develop sila kung kanang mo-adapt sila mo kanang mga psychological intervention na mo fit po sila ang culture kay kasi kanang imong gikuan din ang bawal di ay kay against sila ang culture. So, dapat fit yun sa ilang context and culture. So, ikatulo is staff recruitment, training and supervision and quality assurance. 4 is identification,
assessment and screening and referral. So 5 is monitoring and evaluation. So community engagement kung kanilang 5 is important across this consideration. So next is adopting psychological intervention. Intervention package needs to be adapted for the local context like health system, human resources, transportation, and technology infrastructure. And for the local culture like language, belief system, and explanatory models, gender, and age-based norm. So, mauni ang dapat yung ma-adapt sa psychology para ito ma-adapt nyo para mag-kuha ng intervention sa psychology at mga client nyo. So, first is understandable. So, dapat nakasabot ko sa inyong kuan. Next is acceptable. Dapat pas kung giingon na ako silang culture, dapat ingon mo na yung kay respect kung acceptable ba yung imong ilang panggamit mo na kuan nila. So, ang katulo is relevant. So, is the intervention needed para sa relevant applicable to the environment and context. So, staff selection, training, supervision, and quality assurance. So, iling mag-staff selection daw, kalat mag-use ng mga interviews and potential role play para ma-identify nimo ay makita nimo po ang mga compassionate helpers. So, trainers and supervisory need relatively, dapat high sila, dagko sila knowledge or dagisag knowledge para maka-experience sa mga intervention. So, training is, di ba yung mag-training na kay dati nato ma-measure ang ilahang training and ilang mga competencies ng mga skills. So, nag-use sila diri og use tests or role plays and use of practice cases. So, supervision is ensured consistent and good quality supportive supervision. So, implement quality monitoring from training and throughout implementation. So, quality and assurance. So, ensure quality monitoring that training and thorough supervision during implementation. So, it includes training, assessment, skills, ongoing support, and practice and observation. So, choosing a psychological intervention, numerous World Health Organization and non-World Health Organization is evidence-based psychological intervention manual exists. So, World Health Organization mental health staff in ROs and HQ can advise whether an intervention is evidence-based. So, sila ang mga staff na nag-advise kung sa ilang intervention kung sinakitaan na sila ang client nila. So, next is choice of intervention may depend on a number of factors such as context, availability of trainer and helpers, feasibility, and implementation. So, following are example of different World Health Organization intervention manual with different uses. So, doing what matters of stress. So, for whom adult transdiagnostic like stress and nakafeel sila kuan mo na-experience sila stress, anxiety, or depression. So, para ni sa ilaha. So, what is illustrated self-help book and audio exercises. So, initially developed as part of a stress management course, so Health Plus. So, format is health intervention can be delivered unguided. So, provide lang ng mga book or guided with a brief motivational contact. Like a 10 minutes weekly call. So, ang approach, ay dapat ang gamiton mo is mindfulness based on acceptance and commitment therapy. So, examples, katong nitabo sa Ukraine, katong sa Russia, di ba? So, nag-implement ang mga non-government organization dito ongoing capacity building of health and humanitarian practitioners. So, the next reporter will is Makadasar.
Good day, everyone. So, the continuation, thinking health. So, ang thinking health is about siya sa kalong mama na anak siya, dahil makabali siya of depression, which is the perinatal depression. So, it's time for integration into maternal and child health care programs in primary care. So, delivered by community health workers covers the period from second or third pregnancy trimester to first year or the infant's life. So, i-approach niya siya dito sa CBT, which is the Cognitive Behavior Therapy. So, the second one is the IPT, the Group Interpersonal Therapy. So, para niya siya sa mga adult nga kanang na yung mga anxiety bitaw kanang dali ra kayo sila mga suko kanang dali ra kayo mga nagpala din sila ba nga na mga anxiety gyud kay di hawitan lang ang suko ana. So, sa asa na siya para sa mga ang interpersonal therapy sa evidence based on psychological intervention for depression, adaptive for delivery by specialists rather. So, group intervention, 8 sessions or 6 to 10 members per group. So, approach interpersonal therapy focuses on the current depression. So, katong mga depressed, katong mga anxiety. So, the link between the person's depression and current problems that influence relationship. So, the finding new ways to deal rather with this problem. So, the third one is problem management class or PM class. Para gyapon ni siya sa mga adults gihapon katong may mga stress. So, ang katong isa is katong may mga ano depression pud siya, depression na rin gani guys. So mga stress na rin siya, anxiety. So para sa asa na siya is face-to-face psychological intervention designed to be delivered by non-specialists. So ang format niya is 5 session individual face-to-face or 5 sessions group face-to-face. Approach problem-solving counseling or the problem management. Plus behavioral strategies, stress management, behavioral activation, strengthening social support. So using technology to deliver in-person intervention remotely. So evidence suggests psychological intervention can be delivered remotely with adaptation and training of providers. All the factors required to successful in-person delivery are also relevant for remote delivery. The trust, good report, confidentiality, than the supervision or etc. Addition factors to consider as well. Training and delivering intervention remotely, availability of mobile phones or other technology ensuring confidentiality. So resources of support remote delivered. So na siya link there is open. I'm not sure. So let's proceed the technology supporting self-help. So asa na siya is na siya yung mga books, na siya sa, makita ko din siya sa kanang mga TV or radio, or tayo na ko din siya apps. So why? That increase capacity to reach many more people. Dayon conserve more expensive resources, and the last is reach hard to reach places. So that's all.